Have you ever felt a pounding headache and a sharp toothache at the same time, then wondered which one started first? That question matters more than most people realize. Sometimes the pain in your head is not just a headache. It can be your tooth sending a distress signal through shared nerves in your face and jaw. And the tricky part is this: the pain may spread, confuse you, and make the real problem easy to miss. In this video, we'll break down what headache with teeth pain can mean, why it happens, who is most likely to feel it when it becomes a warning sign, where that pain can travel, and how to respond before it gets worse. We'll keep it simple, practical, and easy to follow. So before you reach for another painkiller and hope it disappears, stay with me until the end. One small symptom in your mouth could be the reason your whole head feels miserable, and catching that link early can save you time, stress, and a lot of unnecessary pain. So what is the connection between a tooth and a headache? It comes down to shared nerve pathways. Your teeth, jaw, face, and parts of your head are linked by branches of the trigeminal nerve, one of the main pain highways in the body. When a tooth is inflamed, infected, cracked, or under constant pressure, the brain may read that signal as pain spreading beyond the mouth. That is why a problem in one molar can make your temple, cheek, ear, or even the side of your head hurt. The where of the pain can be misleading. The why is that nerves do not always report pain with perfect accuracy. The who includes people with untreated cavities, gum infection, teeth grinding, jaw tension, or wisdom tooth problems. The how can feel like throbbing, pressure, stabbing pain, or a dull ache that comes and goes. In some people, the headache shows up before the tooth becomes obviously painful, which makes the cause even easier to overlook. If that sounds familiar, your headache may be talking about your teeth. Now let's talk about the most common causes of headache related to toothache. The first is a deep cavity that reaches the inner part of the tooth, where nerves become irritated and painful. The second is a dental abscess, which is an infection that can create severe throbbing pain and even swelling. Third, teeth grinding or clenching, especially during sleep, can overload the jaw muscles and trigger both tooth soreness and morning headaches. Fourth, a cracked tooth can send sharp pain when you bite, then leave a lingering headache afterward. Fifth, impacted wisdom teeth may create pressure in the back of the mouth that radiates upward. And sometimes the story is reversed. Sinus pressure can make upper teeth hurt and also cause a headache, which makes everything more confusing. So what should you ask yourself? When did the pain start? What makes it worse? Where does it spread? And does chewing, cold drinks, or lying down change it? Those clues matter more than people think. How can you tell whether your headache is actually linked to tooth pain? Start by noticing patterns. If the pain gets worse when you chew, bite down, drink something cold or hot, touch one side of your face, or wake up after clenching your jaw, your teeth or jaw may be involved. If the headache sits around the temple, cheek, ear, or one side of the face, that also adds suspicion. Another clue is timing. Tooth-related headaches often build after a tooth starts feeling sensitive, swollen, or sore. You may also notice bad breath, a bad taste in the mouth, gum swelling, or pain when tapping on a tooth. But here is the important part: not every headache with tooth pain is harmless. If you have fever, facial swelling, trouble opening your mouth, trouble swallowing, pus, or pain that rapidly gets worse, do not ignore it. And if the headache is sudden, severe, unusual, or paired with weakness, confusion, or vision changes, seek urgent medical care right away. So what can you do at home while waiting to be seen? First, do not place aspirin directly on the tooth or gums. That old trick can irritate and burn tissue. Instead, rinse gently with warm salt water, keep the area clean, and avoid very hot, very cold, or very sugary foods if they trigger pain. A cold pack on the outside of the cheek may help with swelling or throbbing. If you grind your teeth, try relaxing your jaw. Lips closed, teeth apart, tongue resting lightly on the roof of the mouth. Choose softer foods for a day or two and chew on the opposite side if needed. Stay hydrated, especially if pain is making you eat and drink less. Over-the-counter pain relief may help some people, but it should not become the whole plan if symptoms keep returning. The key question is not just how do I stop the pain now? It is also, why is this happening? Relief matters, but finding the cause is what prevents the headache and tooth pain from coming back. When should you book a dental visit, and when is it more urgent than that? If your headache with teeth pain lasts more than a day or two, keeps returning, wakes you from sleep, or is getting stronger instead of better, it deserves attention. You should also see a dentist if one tooth feels extra sensitive, chewing hurts, your gums look swollen, or your jaw feels tight and tired most mornings. But some signs need faster action: facial swelling, fever, a pimple-like bump on the gum, pus, trouble swallowing, trouble breathing, or pain so strong you cannot function normally. Those symptoms can point to infection spreading beyond the tooth. And do not forget the medical side. If the headache feels unlike your usual headaches, arrives suddenly, or comes with dizziness, fainting, numbness, weakness, chest pain, or changes in speech or vision, get urgent medical help. The smartest move is simple. Do not guess for too long. Pain that repeats is information, and your body is asking you to listen. Let's wrap it up clearly. Headache with teeth pain is not something to brush off because the mouth, jaw, and head are more connected than they seem. A cavity infection, grinding habit, cracked tooth, wisdom tooth pressure, or even sinus trouble can all blur the line between tooth problem and headache problem. The good news is that the pattern usually leaves clues when the pain starts, where it spreads, what makes it worse, and how your mouth feels along with it. If you notice swelling, fever, worsening pain, or any unusual headache symptoms, do not wait too long to get checked. Early care is almost always easier than delayed care. And a quick reminder, this video is for education only and is not a diagnosis or a replacement for care from a dentist or doctor. If your symptoms are severe, sudden, or persistent, please seek professional help. If you found this helpful, subscribe for more clear health content and leave a comment with your experience, question, or suggestion for the next video.